Good morning and welcome. My name is Kay Spearbud, and I'm an AARP volunteer in Anchorage. On behalf of AARP Alaska, I'd like to welcome you to the second in our four-part Veterans Informational Webinar series. Today, our guest speaker is Nikki Adonisio, Long-Term Care Coordinator for the Alaska Office of Veterans Affairs. Thank you, everyone, for joining us today. Before we begin, I'd like to share a few technical tips for those who aren't as experienced with Zoom. On the slide before you, you'll see down in the lower left corner, the microphone should be on mute. You can tell it's on mute if there's a red line through it. If it doesn't, just click the microphone to mute it and unclick it when you want to talk. Keeping yourself on mute will prevent a lot of background noise. The next button is the video button where you can be on camera or turn your video off. If there's a red line through this button, you are off camera. Please turn off your video today just to save on bandwidth. The next button is the participants button. You will see a list of everyone on this call. It would be helpful for us if you could rename yourself if you aren't logged in with a name. You can do that by clicking on the three dots to the right of your name. We will be asking people to respond in chat. To use the chat button, click on the icon, type in the box, and hit enter when you are done. If you haven't already done so, type in the community you are joining us from today. You can also ask your questions in chat. If you click the reactions icon, you will see that you can raise your hand. Use this if you would like to ask a question verbally. You can also do a thumbs up if you agree with something that's been said and a few other things in there. We are recording this program today and we'll send out the recording and all the links from the chat after the program. Next slide. AARP is a nonprofit, nonpartisan membership organization for people over age 50. We have 38 million members nationally and 77,000 members in Alaska. AARP's mission is to empower people to choose how they live as they age. To optimize their power, we encourage people to save for retirement, stay healthy and fit, including brain health, build strong relationships, and have meaningful activity in their lives. AARP is working on age issues for Alaskans over the age of 50. We do this through advocacy, education, member engagement, and community action. We advocate by working on national issues like Social Security, Medicare, and prescription drugs. At the state level, we are advocating for a sustainable state budget, senior grant program, and increasing the workforce. We educate by offering classes on brain health, technology use, veteran services, gardening, fraud prevention, caregiving resources, and financial planning. Membership engagement is accomplished by hosting social groups, movies, guest lectures, exercise groups, and many more events. And through community action, we have local teams in Juneau, Ketchikan, Anchorage, and Mat-Su working to make their communities more age-friendly. Patrick will now share with us the Wish of a Lifetime mission and vision. Patrick, we can't hear you.
So I'll jump in. This is Teresa Holt. I'm state director. So Wish of a Lifetime provides wishes to seniors. And we're going to share one here with you in a moment, a video of a wish that was for a veteran. But their mission basically is to shift the way society views and values our oldest generations by fulfilling older adults' dreams and sharing their stories to inspire all those of all ages. I just want to say to get a wish of a lifetime, you do not have to be dying. It's very different than some of the other wish organizations. So enjoy this video coming up.
12th of December, 1942. Went in and we took the examination and sweated it out, and at the end of the evening they came back and said, "You passed, now get in line and we're going to swear you in."
There are things to do and places to go, and the Army Air Forces will supply.
A team came to town, and they in the post office, and they were giving tests to get in the aviation cadet. And I passed the test, and I was called up to be an aviation cadet. I was going to fly in the Army Air Corps.
Omaha Basin at the English Channel. I was about the second wave that went in. There was 289 men went over with me, and only 7 of us came back.
I know the first day of World War II, how it started, where it started, what we did, what the generation did. This is something they have to learn.
My grandfather is not only a great American hero, he's my hero.
Oh, if you know a veteran who has a wish, we've granted many wishes for veterans. There's been one group of flyers who wanted to get recognition for the great work they did and the trophy they won. Veterans have wanted to go back. I remember one story, a veteran wanted to go back and fish a river in Europe that he had sat next to while he was fighting over there. So wishes to see family, see friends, go back and do something from your childhood, any of those things can count as a wish of a lifetime wish. So.
Thank you, Teresa, for sharing the wish of a lifetime. And if you didn't catch that web address, Patrick's posted it in the chat. It's wishofaLifetime.org, and you can go out there and learn a little bit more about it. Today, Nikki Adonisio, longtime care coordinator for the Alaska Office of Veterans Affairs, will share information on VA long-term care services available to veterans who are enrolled in VA healthcare. And we will also hear from Paws for Purple Hearts about service animals for veterans. And if you'll give me just a minute here, I will share Nikki's bio. Nikki Adonisio is a licensed clinical social worker and the long-term care coordinator for the Alaska VA healthcare system. Nikki graduated with her master's degree in social work from the City University of New York Hunter College in 1994, where upon graduation, she promptly went to work at the Yukon-Kuskokwim Health Corporation in Bethel, Alaska. Following her time at YKHC, she transitioned into Anchorage and worked for the Alaska Native Medical Center, where before coming to the VA in 2004. When Nikki isn't glued to her computer screen or on the phone with veterans and statewide VA vendors, she spends time with her spouse, who runs a local catering business, as well as adjusting to her new empty nest with kids in college and out of the house. Nikki hopes to enhance the quality of life for Alaska's veterans by assisting them with accessing VA programs that are designed to help them remain independent in their homes for as long as possible. You can reach her at Noreen, Noreen .Adonisio, ADDONISIO @va.gov. Thank you. Nikki, the floor is yours.
Thank you. I appreciate the introduction. I always kind of have slides just sort of to keep me focused, but don't tend to follow them. Although I know that the group here can share my slides with anybody if they're interested. I want to start out by thanking AARP for inviting me. I have worked for the Alaska VA for 20 plus years. And it's my honor every day to serve Alaska's veterans. I love the work that I do. I love to get to offer something to veterans to help them to remain independent. And I'm happy to be here today. Primarily, I'm going to be talking about non-institutional care services. You know, we know our veterans want to be at home in their own communities. Sometimes people don't have a choice, of course, and have to look at out-of-home placements. But today, my focus is going to be primarily on non-institutional services. So the way, and I'm not going to talk for too long because I can see there's only 10 people on the call, and you guys joined the call for a reason, so you probably have questions. So I don't really want to just have you guys hear me drone on for the whole time. So I'm going to just give like a basic overview of the program and leave time for people to ask questions. So I think one of the most important things to know just to start out is that Veterans Health Administration isn't like an automatic thing. So just because someone was in the military, it doesn't mean they're automatically enrolled in veterans healthcare. You have to actually apply for veterans healthcare. So there's an application process for veterans healthcare. It's called a 1010EZ, like elephant zebra. And that's how to apply. And so there's hundreds of eligibility categories, and I'm not going to go into that, although I think it would be a great topic for a presentation if people have additional interest. But the key is that in order to be eligible, in order to know if you're eligible for VA healthcare, you have to apply. And the application process is a 1010EZ. If anybody's interested in taking a look at that, you can go on va.gov eligibility, and it'll lead you through all the process of how to apply for VA healthcare. So the services today that I'm going to talk about are services for people who've already applied for VA healthcare. They're eligible for VA healthcare, and they have a VA medical provider. So having a VA medical provider may mean that you're seen at the Anchorage VA clinic, the Matsu VA clinic, Fairbanks, Juneau, Kenai, or it may mean that you're at Prov Senior Care, and the Prov Senior Care doctor bills the VA through our VA community care program, or you're seen at Search And that search clinic bills the VA through our community care department. So there's lots of ways that people can be enrolled in VA healthcare. But before you can utilize any of the services that I'm going to talk about today, well, not any, but 90% of the services that I'm going to talk about today, you need to have already gone through that process, applied for VA healthcare, be assigned to VA medical provider. Because the way to get any of these programs is through the VA medical provider. They send a referral to our program. We reach out to you and get things moving. So that's just kind of a disclaimer. So once you're enrolled in VA healthcare and you want to utilize some of the non-institutional care services, we've got some options, which is nice because there's not a lot of healthcare organizations that have non-medical options. The first slide up is home respite. And so what's the next slide? Just curious. I haven't looked at these slides in a long time.
The next slide is eligibility.
Oh, they're a little jumbled up, I think, but that's okay. So the first, so if you have the doctor and you are in a situation in your home where you need help with activities of daily living, we have a couple of different programs. We have Homemaker, Home Health Aid, and Home Respite, which are probably our two largest utilization programs. So respite is where you live with someone who cares for you. You're a veteran, you live with someone who cares for you, and that person is afraid to leave you home alone for whatever reason. We have a pretty low threshold for respite. It may be that the veteran actually can be left alone, but the caregiver is just so nervous that every time they go to the store, they're like staring at their phone and bumping into people. They just really need a break. So if the veteran's comfortable with having a respite worker and the caregiver wants it, who lives in the home with the veteran, they're eligible. That's basically the threshold for respite. So your doctor would put in a referral for respite, and the doctor would do an assessment. Same for all our programs. It's called a case mix assessment, and it measures how much help the veteran needs with various things, 16 to be exact, like how much help they need sitting up in bed, going to the bathroom, taking a shower, getting out of a chair, things like that. So based on, and we score that assessment, and based on the score, we authorize service. So say you have a couple in Fairbanks, and the veterans had, major cardiac surgery. Spouse is worried about leaving the veteran home alone and wants respite to be able to take care of maybe her own health issues. Maybe we would send in 9 hours a week of respite for the caregiver to use, and she would work that out directly with one of our VA vendors. So going along with my Fairbanks example, we don't have a ton of vendors in Fairbanks, but it would be like Always Caring, Visiting Angels, or Access Alaska. So one of those agencies we'd send an authorization to, they'd call the veteran and send out someone to do the respite work. Next slide, please. And you could skip eligibility. So the biggest program that we use is the Homemaker Home Health Aid program, and that's for veterans who need help with hands-on care of their body. So we would use that same case mix assessment tool that I just told you guys about, and it would measure how much help the veteran needs with various tasks, and we'd authorize a vendor to come out to the house to provide those tasks. So moving along with that same Fairbanks couple, maybe the veteran who had major cardiac surgery may not need help for a really long time. But right now, they're kind of unsteady on their feet. There's comorbidities, multiple medical issues going on, and the veteran is a fall risk. They can shower on their own, but really, like, they've had some falls, some ER visits. Maybe the spouse is very small, nervous about those falls. So perhaps we'd send an agency in, same agency that does the respite. Perhaps we'd send them in to stand by 3 times a week while the veteran takes a shower, make sure they get dressed, works with them on any kind of exercises they're doing through their physical therapy or cardiac therapy. And we would monitor how that's going through the vendor that sends us monthly reports. We have vendors all around the state, but in still going along with that Fairbanks example, let's say they would have, we scored them as an A. An A allows us to authorize 9 hours. We have a national calculator that tells us, based on the veteran's level of ADL dependency, this is how many hours you should authorize. So say we authorize 9 hours of personal care and 9 hours of respite with Visiting Angels in Fairbanks. That veteran would now have 18 hours with Visiting Angels, who would be providing the service, working out the schedule directly with the family, and sending us monthly reports and letting us know how things are going. If it went for a full year, which is what we typically authorize, at the end of the year, the doctor would send us a new referral and say they don't need it anymore, or yes, please continue. This service is what allows the veteran to remain independent in their home. Thank you. Next slide, please. Adult Day Healthcare is a program for veterans who want to be involved in a structured activity in a program like LifeWorks in Anchorage or Turnagain Social Club. We don't have a ton of vendors for Adult Day Healthcare. We've got LifeWorks, Turnagain Social Club, Homer Senior Center, Adult Day Program, and LifeWorks in the Matsu Valley. That's it. So if veterans are interested in attending those programs, what they would do is take a tour, see if it's a good fit for them, and ask their VA doctor to put in a referral. And then we'd work with the veteran and their family in authorizing that service, and the VA would cover that. Next slide, please. So again, I talked about the referral process. So if veterans are asking questions about these programs, the best thing to do is refer them to their VA medical provider, who will do the assessment, and then we reach out to the family and authorize the service. Next slide, please. So this slide talks a little bit about who is eligible for our programs in general. I mean, you don't, if anybody's ever heard the term service connected, I'm not going to get into the details of that, but you can be eligible for VA healthcare and service connected, which means that when you left the military, you told the VA that you had an injury of some sort, you were evaluated and given a percentage rating. And you may hear that term on occasion, service connection. You do not need to be service connected for the programs I just talked about: Homemaker, Home Health Aid, Respite, and Adult Day. All you need to do is be eligible for VA healthcare. There is no requirement for service connection. There are states across the United States that do require service connection for this program. In Alaska, we do not. There are some various things that change depending on your level of service connection, and one of them is nursing home care. So we have some contract nursing homes around the state of Alaska, and the way a veteran would be eligible for contract nursing home is they would be 70% service connected or higher, basically. There's some other nuances of it, but basically it's 70% service connected or higher to be able to go into a contract nursing home. We have 2 of those in Anchorage right now, Prestige and Providence Extended Care. Going north, the next one would be Denali Center in Fairbanks. Going south, the next one would be Seward, Mountain Haven. I think we have 8 contract nursing homes right now across the state. So the veteran would need to be eligible for skilled nursing facility in order to be eligible for this program. Next slide, please. You can keep going, Teresa. Thank you. So I talked about this too. You can keep going on this one also. So community nursing home placement, what I just talked about, you work with your medical provider on applying for the facility to see if you're eligible, and then we would look at the service connection. Next slide, please. So the next program I'm going to talk about is our Veteran Directed Care program. So for that program, it's not all over Alaska. Right now we have it in the Matsu, the Kenai Peninsula, Valdez, Kodiak, Southeast Alaska. And the way to be eligible for veteran self-directed care is the same process as homemaker, home health aid, and respite. You go to your VA doctor. They do the same case mix tool that we use for the other programs, but instead of the score dictating like a letter score that authorizes a certain amount of hours, the assessment dictates a budget. And the budget is for the veteran to direct on their own in order to be able to hire people to provide nursing home level of care to them in their own home. So they get a budget, and the budget goes through one of our partner organizations. In the Matsu, it's Matsu Links, and I saw that Dawn was on the call today. Hello, Dawn. Thank you. She and Thomas Brass are our partners in Matsu Links. And then on the Kenai Peninsula, our partner is the Independent Living Center. And in Southeast Alaska, our partner is SAIL, Southeast Alaska Independent Living Center. So the budget goes through those organizations. We pay them to go out to the veterans' home and help them set up the whole program, a spending plan, everything they need, how to hire their own employees, workers' comp, taxes. So they go out and help the family get this all set up. And then they fee out with a payroll management service. So payroll goes through an organization called AARP. And once it gets all set up, the veteran starts their business, and it's basically a business of providing their own care. They get to direct what that's going to look like. But bottom line, it's for veterans who need nursing home level of care and are able to direct a budget on their own, or they have a trusted person that can direct the budget for them. So that's kind of veteran self-directed care in a nutshell. Thank you, Kay. I can see your question pop up. And this is a different program than the Program for Comprehensive Assistance for Family Caregiving, PCAFC. Not complimentary, it's actually a different program. And I know that you guys have a speaker that's going to talk to you about the caregiver program next week. So veteran self-directed care is unique to that program in specific. Thank you.
Nikki, I have a question. So can they hire anyone, like their spouse, their neighbor, their grandkid? Can they hire anybody?
They can, Teresa.
Okay.
So next slide. We can keep going. Sorry. The slides are kind of repetitive. You know what? The slides are throwing me off. I'm not going to look at them anymore. We talked about respite. We talked about homemaker home health aid. We talk about adult day services. We've talked a little bit about veteran self-directed care, although I think people are really excited about that program. And you guys may have a lot of questions. We've done really well with the veteran self-directed care program. We have over 100 veterans across the state that are utilizing it right now. And, you know, it's allowed people on a ventilator to remain at home. It's allowed people who have a very high level of skilled nursing needs to remain at home. And it's really given veterans the ability to direct what this portion of their care should look like. And we've had a lot of success with it. You know, with veteran self-directed care, it's really not for everybody. It's for a veteran, like I said, who can direct their care, or they have a trusted person that's able to do that. For some people, they prefer using agency support because, you know, maybe they don't know people to hire, or they live alone and they don't have family and friends here, and it's challenging for them to identify staff. Some people just prefer to use our vendors, and that works out really well for them as well. We have veterans who start off on the homemaker home health aid program and respite, and then ends up transitioning to veteran self-directed care, and vice versa. We've had veterans on veteran self-directed care who've transitioned back into using homemaker home health aid and respite, because it's just been too hard for them to manage their own staff. And as you all know, all around Alaska, with almost every field, staffing is challenging. I mean, the agencies have a high level of turnaround, and when the veterans take over and they're not using family, even sometimes when they are using family, there's a high level of turnaround with care. So we've talked a lot about non-institutional care programs, and we're at the 11:30 hour. So I'm gonna hop into this chat and see what questions I'm missing. I know Dawn said they have to be over 18 years of age. So when going back to the Veteran Self-Directed Care Program, your employees have to be 18 years of age or older. And then Kay asked, when a veteran is referred to a vendor, are they able to pursue someone that is similar in personality and or language? Yeah, I mean, so say for example, a veteran wants Tagalog speaking PCA. I may give the veteran, or I may help them call a bunch of vendors to see if anyone has any Tagalog speaking veterans. I mean, we don't always know employees. We don't always know like what staffing looks like with various vendors. We keep really close communication with our vendors. They'll text us or email us and say, hey, we've got like some really good people in the Valley right now that are looking for veterans. So we know, like, for example, Comfort Keepers has some availability in the Valley. As far as language, yeah, I mean, of course, there's meet and greets. The vendor goes out and they meet with the family. They get a feel about each other. And then if there's specific requests regarding personality and or language, the agency can certainly try and accommodate. It's been really challenging lately with staffing. What other questions do people have? I'm gonna stop talking for a little while.
So Nikki, I'm going to ask you the question that always comes up because we can't repeat it enough because it's so confusing. But can you just quickly go over the difference between service-connected disability, VA health, and VA benefits?
Yeah. So, and again, I don't work in the eligibility department or for Veterans Benefits Administration. But the way I kind of describe it to people is think about like a bouquet of balloons, right? We've got a yellow balloon, which is the burial and memorial program. Let's say a green balloon, which is the Veterans Benefits Administration, and a pink balloon, which is the Veterans Health Administration. The balloon bouquet is the same bouquet, but they're all different. You know, they have their own helium. So that's kind of a symbolic way of describing it. So Veterans Health Administration is the organization that I work for. And that's when you're receiving health care through the VHA and are assigned a doctor. Now, if you want to pursue a service connection, you would do that through the Veterans Benefits Administration. So say, for example, you have an 82-year-old that's never, you know, that's eligible for VA healthcare, but they've never applied for a service connection and they're hard of hearing and they want to now. They want to apply for a service connection because once they have a service connection, maybe they won't have a copay. So we know that the military didn't do a ton to protect enlisted people's hearing back in the day. So hearing loss is kind of a typical service connection that you might see. It's a low service connection, maybe like 10%. So they wouldn't be eligible for nursing home, but it's something that a veteran can pursue through the Veterans Benefits Administration. The best way to do that is to get a veteran service officer, a VSO, through like American Legion, VFW, Order of Purple Hearts. There's service organizations that you can utilize, and they kind of act as your tour guide through the VBA, helping you figure out, you know, all the things you need to do to pursue that service connection. So people use a veteran service officer to pursue service connection for their loved one. And there really isn't, it's never too late. You know, you can always pursue that. You just have to be ready to kind of keep a notebook and document who you speak to. And, you know, it's not an overnight process, but certainly worth pursuing through the VBA. So I don't know if that answers the question, Teresa. Am I leaving anything out?
No, that was great. So Leslie has a question. Does qualifying for these services impact eligibility for the Medicaid home and community-based waiver?
No, it wouldn't impact it at all. Although a veteran would, if they had a Medicaid home and community-based waiver, they may want to make that choice for them and decide which benefit they want to use for non-institutional care, what makes most sense for them financially. You cannot use both a Medicaid waiver and VA long-term care benefits. So people do need to make that choice and decide which thing is best for them to utilize for specifically for services in the home. Does that answer your question, Leslie?
Well, while we're waiting to see if Leslie puts something in chat, I'm going to ask you another question. So, as you know, I used to be the long-term care ombudsman, and we would often end up with somebody who, maybe had a heart attack or a stroke. They ended up in the hospital, maybe went to a nursing home for some rehab, and they're a veteran and they haven't connected for anything. What is the first place for them to start? Like, where do they start?
1010EZ, which is the application for VA healthcare. So first apply, see if they're eligible for VA healthcare. Eligibility is pretty complex. Not everybody is eligible for VA healthcare. You have to either be, and I'm really boiling it down and extremely summarizing, but you either have to be low income or service connected, or had some type of exposure to a pollutant of some sort to be eligible for VA healthcare. So not everybody is eligible for VA healthcare. Or you could apply when you're in your 50s and not be eligible, and then things change financially, or you just decide to pursue a service connection while you're in your 70s. So maybe you weren't eligible in your 50s and now you are in your 70s because things have changed. So the best thing to do is apply for VA healthcare. And then once you determine eligibility, get assigned a VA medical provider. So you can work with your discharge planner if you do have a catastrophic event like in Teresa's situation on helping with that. Our program, which you can see on the screen, myself, my nurse partner, Meadow, Corey, my social work partner, Erin, Yahira, and Eileen, we work closely with all the hospitals around the state of Alaska who Teresa came up with this example for good reason. This comes up for people a lot. They've had a catastrophic event. They want non-medical personal care. Really, there's hardly any other insurance that covers that. So now they want to pursue accessing VA healthcare. And so they may be working with their discharge planner at Peace Health in Ketchikan or at Alaska Regional. So a lot of the discharge planners have a high level of familiarity with how to access and help people navigate that resource. Does that answer, Teresa? Or anything?
Yes. It just came up often, somebody who maybe didn't need any services wasn't, really counting on it. And then, I saw many folks who were able to go home versus going to an assisted living home or a nursing home. They sort of put all these services together and it was great. They were really happy to be able to go home.
Mm-hmm. Yeah. I mean, to me, it's like the biggest honor. Like I was saying earlier, it's not, when you meet a veteran who's like 92, who never wanted to bother anyone, never wanted to utilize VA healthcare. And now they realize like no other insurance really covers non-medical personal care. And they want to access VA healthcare. It's really amazing, to be able to get those services in, finally, services that they deserve so deeply, and be able to get that in and help them fulfill, a desire to be independent in their own home and be able to go home. So it's really, great for us to be able to help people at that point. I know I can see Leslie has some other questions. So you said that it's an either or choice. Yeah, sorry, I must have misunderstood your question. I didn't know if you meant if the Medicaid waiver impacted anything financially, but yes, it's a choice. The veteran decides to either use their Medicaid waiver for non-institutional care services or VA. But right, yeah, that's true. It's a choice. So you said, can you speak more about the nursing home respite stay for up to 30 days a year if the primary caregiver is incapacitated? Thank you for bringing that up, Leslie. So if we have a veteran who wants to use a nursing home, a contract nursing home for a respite stay, the best thing for them to do would be to work with their medical provider on putting together a packet for the nursing home to apply, you know, just like anyone else would apply for a nursing home visit. And if the stars align and they're able to get the veteran determine that they're clinically eligible for the community nursing home and the dates work out, a veteran can stay in the community nursing home for up to 30 days if the caregiver needs it for a significant reason. Does that answer the question, Leslie? I don't know if you're able to take yourself off mute, but I'd be okay with that if you wanted to chat.
So Nikki, I have another question, and I just want to see if I understand it right. So if folks are in a nursing home, the VA provides for all the cost of that versus if they lived at the Anchorage Pioneer Home, or not the Anchorage, the Fairbanks Pioneer Home, which is an assisted living home, where they only provide part of the payment. Is that correct?
So no,
Okay.
the VA doesn't pay for assisted living at all, ever, under any circumstances. We do have a domiciliary program, which is a VA term. And we do have a state veterans home, and it is the Palmer Pioneer Home, not Fairbanks. And we pay a per diem rate for veterans who are mostly independent, like they can propel themselves to the dining room, manage their toileting, manage their ADLs for the most part. So if they're living in the Palmer Pioneer Home and they're not a high level of care, they're eligible for a daily per diem rate towards the cost of care at the Palmer Pioneer Home. It's about $50 a day. With that being said, there's a neighborhood in the Palmer Pioneer Home called Homestead. It's one of the wings. And that one is designated by the VA only as nursing home level of care. So if you're one of those 70% service connected or higher veterans and you're living on the Homestead unit at the Palmer Pioneer Home, you will not have any out-of-pocket cost. If you're a 70% service connected or higher veteran who are living at one of the contract nursing homes around the state, you will not have an out-of-pocket cost. But the VA does not cover assisted living anywhere ever.
Thank you for clarifying. And then all the other services that you talked about today are free. There's no copay. Not
yet. There's a lot of talk about copay for personal care, respite. And there are other VA healthcare centers around the country that do have a copay for that program. And it may very well be that at some point in Alaska, we will have a copay for those services. But right now there isn't one.
And then we have a question from Kay. If a veteran is using an approved community health care instead of a VA provider, can the community health provider make referrals to this program, or does the veteran need to return to the VA for service?
Great question. And the answer is yes. The community health care, the VA community care provider can refer directly to our program, and the veteran does not have to return to a VA building for service. They can be choosing to get services in the community, or that may be the only option. We have a lot of areas where there is no VA clinic. So we have tribal sharing agreements all around the state of Alaska. So with our Alaska Native veterans, if they're receiving care through a tribal health organization and they're eligible for VA healthcare, we can take referrals directly from that tribal health organization. If they're not Alaska Native and getting healthcare through Peace Health or Search, the provider at Peace Health or Search would send a request to our community care department, requesting on the veteran's behalf to act as their VA community provider. And every time they saw the veteran, they'd bill the VA, and they act as the VA provider and can refer directly to our program. That's kind of how that works. Does that answer the question, Kay?
Yes, thank you very much.
Yeah, we get probably half of our referrals from community providers that are not directly VA. What other questions do people have? Often people have lots of questions about the Veteran Self-Directed Care Program.
So if you want to just ask your question, you can go under participants and click your mic, or there's a bar either above or below on your screen where you can click on your mic, and it should take the red line off if you want to ask a question verbally, or you can put it in chat.
Nikki, this is Kay again. A question for you. Are the medical providers, are they knowledgeable on these programs? And the reason I ask is my dad, who's a veteran, had an appointment the other day, and his disabilities are progressing extensively, and this wasn't mentioned at all. And this would be perfect for him.
Where does he go to the doctor?
At the VA.
Oh, yeah. I mean, some have a higher level of familiarity than others.
Okay. Well, I'll follow up, because I think this is exactly what he needs right now.
Yeah, absolutely. I mean, the best thing to do would be to call the nurse. You know, your dad's patient aligned care team has a nurse care manager, and just, you know, let them know, you know, this was not addressed, and the nurse care manager can reach out to your dad and do a case mix assessment over the phone, because he was just seen. So probably, you know, he wouldn't need to go back to the clinic and get that sent out to us, and we'll score the assessment and call him and reach out to him and see if he's interested in services. A lot of times we have veterans that need the service that really don't want it. You know, they're super proud and they're not comfortable having someone help with hands-on care. So sometimes it takes us a really long time to talk people into it and just introduce it, and you know, have it be something that they're comfortable with.
Thank you.
And I think for providers in the community, you know, some of them really just struggle with navigating VA healthcare. It just seems like a big tough nut to crack. Some community providers are really good at it, and some struggle more. So we reach out to all the community providers that are working with our veterans regularly. We let them know when the authorization is about to expire, when we need a new assessment. So we're reaching out all around the state all the time. And then another exciting thing that I didn't mention is that our next region where we're going to be offering veteran self-directed care is Fairbanks. So the Aging and Disability Resource Center North has reached out to our Veterans Healthcare Administration here in Alaska to pursue the relationship with us that MatsuLink, SAIL, and ILC has. So I'm hoping maybe by this summer, Fairbanks will have the Veteran Self-Directed Care Program available to veterans who meet nursing home level of care.
Wow, that's exciting progress. If there are no further questions, we'll move on to a short film. Give it just a second here. And again, we've got the slide up with the all the contacts, and those will also be emailed out to everyone if you didn't catch those. Nikki, did you have any closing remarks for the group before we move on?
Thank you all for having me today. Certainly, if you have additional questions, please feel free to email me, call me. If you want to utilize the service, reach out to your VA medical provider. If they have questions, you can give them my direct line. Thank you, everybody.
Thank you so much. So this next slide is a short video for you about Paws for Purple Hearts that provides service animals for veterans, and Melissa Kay is the program presenter for Paws for Purple Hearts.
Hi, my name is Melissa. I'm a program instructor at Paws for Purple Hearts. We're a nonprofit organization with 7 locations across the United States. Our mission is to breed, train, and place the best service dogs available with our warriors in need. We use the term warrior to identify anyone who has served, is serving, or will serve. We have a secondary mission, and that is to educate the public about service dogs, about laws that apply to service dogs and their people that are with them. Since 2006, we have been doing programs called Canine Assisted Warrior Therapy or Intervention. And what that means is we partner with a licensed practitioner, whether they're a mental health provider, or a rec therapist, licensed clinical social worker, any licensed practitioner who is working primarily with warriors. And with that, we bring our dogs. We come with the dogs. We provide the program, and we implement the dogs into the therapy for the warrior. In this way, they are acting as battle buddies or wingmen as they help us train the dogs for a warrior in need. This has been a fabulous program and one that we totally enjoy doing, and we offer to any location for free. Back in November, there was the Paws Act. I'm going to look at it so I get the name right. It's Puppies Assisting Wounded Service Members for Veterans Therapy Act. I always get one of those words wrong. So we call it the Paws Act. So last year, at the end of the year, it was signed into being that there was going to be a 5-year pilot program to determine if service dogs, psychiatric service dogs, would be helpful to our nation's warriors dealing with PTSD. Currently, the VA has a benefit for service dogs, but it only covers mobility dogs. And so thankfully, this Paws Act is now happening, and our location here in Anchorage, Alaska, along with our location in San Antonio, Texas, have been chosen to be part of this 5-year pilot program. So we have started that we have 2 days a week. We have warriors come to our location and work with our dogs in training. One of them is this young man right here. This one's Paul, and he's only 7 months old. But he is working with our warriors and has been working with them since he came to us in October. So this is a really wonderful program, and it's one that we offer warriors through the Paws Act. And the warriors sign up for the program through their mental health provider, which they have through the VA. Now, this is not a new program for us because, as I said, we do the Canine Assisted Warrior Therapy, and we've been doing that since 2006. We currently have about 40 dogs in training, and of the 7 locations across the United States, every week we are doing multiple programs. We're going out and doing social therapy, working with active duty service members. We're working with veteran hospitals to bring our dogs and the therapy program to them. We are located in Anchorage, Alaska on Arctic Boulevard between Raspberry Road and Diamond. We're small, there's only a couple of us. So if you would like to come by and meet us, meet the dogs, learn more about what we're doing, we welcome you to come. Just give us a call before you come by so that we know you're coming and we make sure someone is here to greet you. We love to meet the members of the public. Are there any questions, Curtis, that people may be asking?
All right, thank you, Patrick, for sharing that with us. And again, Patrick's put the web address in the chat box for those of you that want to follow up for more information. And Patrick's going to bring up a poll. Thank you again for participating in today's program. We hope you found it very helpful. Please let us know what you think, and we thank you for your feedback. If you have any ideas for upcoming webinars, please put them in the chat as well, and we'll follow up on those. And there's the poll up on your screen. And Patrick, do they just click on that, or? Yep,
Yes, you can just click on the answer that you want and then submit. So we've had a couple people do that. We'll leave it up for a few seconds more.
Okay, while you're answering that, this is just a reminder, you can find any future events on www.aarp.org/AK. If you're interested in registering for upcoming Veterans Informational Webinars, you can go to that same web address and click on the story titled AARP Alaska Announces 4-Part Webinar Series for Veterans in the First 4 weeks of May. That'll take you directly to the web page. This webpage is also a place you can view the recordings of previous webinars in this Veterans Informational Series. Next week, you can join us on Tuesday, May 16th, 2023, and our topic will be Caregiving, Hearing, and Vision Services from the VA. Susan Guillory from Alaska VA Caregiver Support Program will talk about the numerous supports and program for those caring for veterans. Dr. Michelle Fernelli will speak to audiology services for veterans with hearing loss, and Laura Cabot Kennedy will talk about low vision services from the VA. And again, you can go register for those seminars at https://events.aarp.org/Veteran Appreciation Virtual Series Part 3. Thank you again to Nikki for sharing this important information on long-term care services for veterans with us today. Thank you also to Melissa for Paws for Purple Hearts. And thank you for joining us for this webinar series. We will be hosting a webinar series every quarter. We are planning future series on financial planning, technology, and a workout series during the winter months. Again, you can find out more information on the webpage at www.aarp.org/AK. And thank you again for joining us today.